Hey guys, I'm Ian Harvey, massage therapist. Today we're going to talk about this pre-massage massage thing that I've been developing over the past year or so. It's something that I've been using with my clients who have complicated hip, low back, and sciatica pain. So if they're having all sorts of stuff going on around here, around their pelvis, then I don't want to just work with the body in a two-dimensional way. I don't want to just press down on it. I want to get the femur moving. I want to get the hips moving and the pelvis moving, and hopefully mobilize some of these structures as I work on them. And I've been finding that I've been getting a lot of excellent results from this, and my clients really like it. So if you've got a client who comes into your office with sciatica pain or anterior hip pain, or their hips and pelvis just aren't working how they want them to, especially in your athletes, then doing this pre-massage routine can be very helpful. We're going to be doing a lot of jostling and compression and stretching today. So if your clients are wearing stretchy clothes like tights or shorts, then that can work very well. If they're wearing jeans, you can still do a lot of this, but do ask them to consider bringing in something a little looser or stretchier if they like this pre-massage routine. And I would like to point out that you can still do all of these moves with a client who is unclothed and who is draped. Just realize that you'll have to do some different stuff with the drape. You might need to use diaper draping. I'm going to leave all that for you to figure out. I really like this clothed routine. Keep in mind that this is going to eat up about 20 or 25 minutes of your massage, so do keep that in mind, budget accordingly, or have that conversation with your client and let them know that they're only going to get about 30 minutes of that hands-on traditional massage. So in a second, we're going to get a client on the table. I'm going to show you how to work with the anterior body with the hip flexors. We're going to do some stretching for the posterior pelvis. Then we're going to turn the client into side lying. And finally, we're going to do some stretching, compression, and jostling while they are face down. If you'd like to skip ahead, click on the time codes down in the description. So I've got Summer here with me today.
Hello.
Hello. Summer, today I'd like to try something a little bit different. I'd like you to go ahead and climb on the table. Go ahead and take your shoes off, and if you have any jewelry, feel free to take that off too if it's uncomfortable. And climb face up onto the table with your knees over this guy right here.
Okay.
So, that's how I would communicate that. Lay down, for heaven's sake. That's how I would communicate that. I would let them know that I want to do something a little bit different and have them get comfortable and then climb on top of the top sheet without disrobing. So start this clothed massage routine just with some gentle compressions. What we're doing right now is we're introducing the concept of this whole pre-massage massage thing, and we're getting the person used to this feeling of compression. Use nice broad hands and allow your body weight to do this work. So sink in with the weight of your torso, rock your own body, and allow the elasticity of your client's body to push you back up. So not only are we introducing this concept of our compressive touch, we're also introducing this concept of movement. So every time I'm compressing, I'm rotating this thigh. It's pretty subtle, it's not huge, but we're getting the client to start letting go right now because we're going to be doing some stuff that's a little more kinetic and extreme later on. We're going to be moving their leg around quite a bit more. So if we can get these muscles to unlock and to stop holding at the very beginning, that'll be helpful later. Now what I'm demonstrating is more for your more athletic clients. So if you've got someone who may be a little more fragile, maybe they're in a state of more acute pain, or maybe they're older, then be a little less vigorous and use less range of motion. And at all times, track your client's face. Make sure that they are not grimacing, that they're not holding their breath. Now with this routine, this is also a good chance to evaluate your client's pain. So I'm going to sink my body down, and I'm going to start alternating pressure with each palm down into this IT band as I'm rotating this leg inward. So just allow this to be very kinetic. Allow there to be a lot of movement. And Summer, do you have any pain down in your IT band?
No, it feels pretty good.
Okay. So Summer is a runner, so she knows what IT band means. But if you've got a client who may not, then just say down the side of your leg. And now we're going to move up toward this ASIS. So feel for that bony prominence And we're going to work just inferior to that. We're going to be working with this TFL, this tensor fasciae latae. To do that, I sink the palmar surface of my hand in. I let my hand mostly relax and I allow it to cradle this ASIS. I find that to be a very comforting contact because this can be quite tense. This can be quite sensitive. And so this lower hand is creating movement while this upper hand compresses this TFL. And I'm starting with a very nice broad contact to the tensor fasciae latae. And because the TFL is a hip flexor, I'm going to want to work with this with the femur in a lot of different configurations, but it's also a hip rotator. It's an internal rotator, a medial rotator. So I'm going to rotate this leg as I work with it. And make sure to come down to the side. I'm going to anchor my elbow into my own hip region. And now I can come to the side of this ASIS. Now I'm on the lateral pelvis. And again, I'm introducing some movement with this palmar surface of my hand, and with this lower hand, I'm still rotating the femur. So we're working into gluteus medius and minimus. You can also use your fist here. So come all the way up to the iliac crest, and all the way down to the greater trochanter. Now, there comes a point when you're going to want to have a conversation with your client, because I kind of want to cradle this leg. I want to bring it up to my body so that as I'm moving it, she's not having to take over. If I try to move this leg while it's at arm's length, the client is very liable to try to assist. Versus if I have this connected to my own body and I'm moving it by lunging, they're very unlikely to want to take over for that. It's going to feel very stable. But that means having a conversation with your client. So Summer, is it okay if I kind of cradle your leg to my body as I work? Just let me know if I'm ever too far into your personal space, okay?
You got it.
All right. See, easy as that. So we're going to bring the foot up onto the bolster or the pillow and connect the client's leg with your own torso. So I've kind of got it on my lower thoracic region right here. And from here, I can do some nice compression to either side of the leg. We can start working with these adductors and abductors. And I can change the angle of this knee quite easily, so I'm going to lean it over and add some friction to this vastus lateralis region, which can feel really good if someone's got a tight IT band. And while the leg's up like this, you can do more of that direct work toward the TFL. You're going to have less space here, so you might need to use a more direct tool, such as a thumb or fingertips. And just realize this is going to feel a little bit sharper, but because we brought this TFL into a shortened, slack position, we can work with it more directly without it feeling like it's being attacked. And now with the client's leg up like this, we can angle the leg away. That's going to take the lower part of the trunk with it, so that's going to carry the pelvis along. And now I can lean down, anchor my elbow into my own hip, and apply some nice pressure to glute max, glute medius, and glute minimus. So from another angle, I've got my elbow anchored into my hip, and now just by lunging my body, I'm able to apply pressure in this direction. I can even angle it just a little bit upward, and as I do that, I can manipulate this femur just by moving the knee. This is creating some nice circular movement at the hips. This is mobilizing the pelvis, it's mobilizing the femur and the sacrum. And we're getting into these hip rotators, all while getting them at various levels of stretch. And now you can bring the leg up, and again, the more you cradle this leg, the less they'll feel like they need to help. The closer you keep it to your own body, again, the less like they'll feel like they need to help. So what I want to do is create some stretch in these hip extensors back here by bringing the knee up. When you're stretching a client, just feel for when their nervous system starts pushing back, and don't go that far. we want to start at a nice, easy place now. Now, Summer is very flexible. You might only be able to go this far with some clients. You'll start feeling just a little bit of tension, at which point you should back off and then go back into the stretch. I like short pulsed stretches rather than long, sustained stretches, but that's just me. And at all times, keep your eyes on your client's face. If they're cringing at all, if they're holding their breath, then you're doing too much. And you can always communicate. Now, Summer, are you feeling this stretch, or would you like this to go further?
It can go further.
Okay. So I'm going to have Summer bring her arm out of the way, and then we can make this a deeper stretch. Is that a bit better?
Mm-hmm.
Okay. And again, just by changing the angle of this low leg, I'm able to change the feeling in the posterior pelvis. Now I've got my hand on the outside of the knee and my other arm cradling the calf, and now we can do a little bit of internal rotation. And be gentle with this. We're going to be doing this a bit more while the client is prone. Now that the hips are warmed up, we've done some nice stretching and movement, I would like to do some work more directly with these hip flexors, specifically with iliacus. So to do that, find ASIS, the anterior superior iliac spine. We've just worked inferior to that to work with tensor fasciae latae. Now we're going to come medial to that, and we're going to be making contact with that inner bowl of the pelvis, that inner portion of the ilium. At this point, I do like to communicate with my client. Summer, would it be okay if I worked with your lower abdomen for just a moment?
Sure.
Okay, now as I press in here, this may feel a little uncomfortable. If you don't like it, please do let me know, okay? Easy as that, no problem. And take this easy at first. Track your client's face. And Summer, is this uncomfortable at all?
No, feels good.
Okay, good. And I've got the client's leg once again against my torso, so she's not having to engage this iliacus as I sink into it. And I'm not doing any digging here, I'm not working on knots. I'm just sinking in and I'm acknowledging it. And as I do so, I'm feeling for softening. You may feel the iliacus soften under your hands, or you may not. Either way, giving some new stimulus to this rarely touched muscle can make some profound changes. We could also work with psoas from here, but I tend to like to take a good long time when I'm working with psoas. If you'd like to see more information on that, check out the video that's playing in the corner there. And once you've warmed this area up and you've acclimated the client to this contact, then you can do something that I like to call the ilium sandwich. So we're going to be working on gluteus medius and minimus and iliacus at the same time. So continue this downward pressure that's angled this way, and you can apply a thumb to this lateral pelvis. So we're just south of the iliac crest and just north of the greater trochanter. And this is going to change the sensation on iliacus. I don't know why. It's just nice to have this ilium sandwiched between fingers and thumb. And if your thumb doesn't like this position, then don't do it. You can add a little bit of movement here, just laterally left and right, and you can add some movement with your torso. And then we're going to straighten the leg back out, go slowly there, and just do a little bit more jostling and movement. All right, so now that we've done all sorts of good work with the client supine, we're going to, Summer, go ahead and raise your knees up. We're going to remove this bolster. And then, Summer, go ahead and turn away from me so that you're on your left side. And use your right arm as a pillow. And if this isn't comfortable for your client, then get them an actual pillow. So now that you've got the client laying on their side like this, you can apply some nice pressure downward. Notice that I'm not pressing this direction. That's going to roll them off into oblivion, and that's not fun for anybody. So I'm pressing down toward the table, and if I do feel like pressing in this direction, I'm also stabilizing in the other direction. So keep your client stable as you work on them inside lying. I'm going to be using thumbs here, I'm going to be using fingertips, and we're going to be working on those same structures that we were working on before, but now we're able to encompass this greater trochanter, once again giving it some movement, giving it some mobilization as we work all around it. So work toward the front of the hip, toward the TFL, work up toward the iliac crest, and down toward that sacrum. So you can use your thumbs here, you can use your fists, you can use your heel of hand. Just make sure to stabilize this pelvis as you do so. You can allow there to be some movement, just don't make it feel like they're going to tumble off the table as you do so. Very important. There's all sorts of fun stuff that you can do here, including working down toward this quadratus lumborum, but for the purposes of today, I'm just worried about these hips and this low back. And something that I find very useful is to stretch out these hip flexors. To do that, I scoop up this knee by bringing their foot to the inside of my forearm. So here's my forearm, this is where their foot goes. So I cradle this knee using my left hand. My other hand stabilizes this hip, and then I press their foot against my hip. So I've got this entire lower leg very well braced because there's nowhere for it to go. It's trapped between this hand here and this hip here. If this is a little bit too much for you, if you don't want a foot touching your hip right here, then you can bring this leg to the outside of your arm. Just realize that it's going to be a little bit less stable and you may need the client to help. This can still definitely work though. So scoop up this leg, scoop up this knee, place the foot against your hip or against your upper thigh, and then stabilize the other hip. And now, just by moving your body, you're able to bring this entire hip region into extension. So, just by stabilizing here at the hip, we're able to get a stretch to all of these anterior muscles. So let your body movement do this work. This doesn't need to be your muscles doing this. And every time you bring this leg into extension, you can be massaging this glute region. So I'm sinking in with the heel of my hand all around this greater trochanter, all around this SI joint. You can make this a little more extreme just by rotating your body a bit more. So Summer, let me know if this is too much of a stretch, okay?
Okay.
Just go slowly with this. And then to return the leg to the table, grasp the ankle and just gently bring it back over. And Summer, go ahead and go face down, put your face down in the face cradle. So now that we've got the client in this position, you can once again place a bolster under the ankles or not, depending on your client's comfort level. And we can mobilize this sacrum, we can mobilize these hips. We can start working directly with the low back a bit more as we continue this vigorous work. Compress in toward the SI joint. You can use fists here. You can use your palm. If anything starts to fatigue, then switch tools. Switch tools before you fatigue if possible. And to finish this routine, just pluck one of your client's ankles up, place the other hand in the hip region just to stabilize, so I'm pressing right against that SI joint. And now, if we pull outward like this, we're bringing the femur into internal rotation. And just gentle pulses of this. Summer is quite flexible in this direction, so I don't feel like there's a lot that I need to do. But this is stretching all of those external rotators, including piriformis and its friends. You can do different angles here. Bring them into external rotation, working along that SI joint up into the lateral pelvis. And again into that internal rotation. And end with some nice traction. Alright guys, that's it for today. Let me know what you think in the comments. If you have any suggestions of your own, any alterations that you'd make, consider subscribing, and I'll see you next time.
Bye.